So before performing the exam, the first thing I would do is take a thorough health history and then perform the other body system assessments as well. So the first thing I'll do is inspect the abdomen, looking at the contour of it, making sure it should be flat or rounded would be normal as well. Making sure that it's symmetrical, it should be non-distended would be normal, and symmetrical. So can you take a big deep breath for me? Which both sides should rise symmetrically, which they do. Also would be looking for pigmentation. The color should be consistent with the rest of the skin. Also looking for the vasculature. The vessels should be non-distended. They could be visible in a thin person, but they shouldn't be distended. Next thing to do is look at the umbilicus. It should be flat. It could also be depressed. And as well on the skin, there should be no lesions or rashes, so looking for those as well. Next thing I'll do is look for pulsations or any peristaltic waves, which would be abnormal findings. The only thing that could be a normal finding would be the aorta. There could be a small pulsation there if the person's thin. So next thing I'll do is listen to the bowel sounds in all 4 quadrants. So normal findings for those would be normal bowel sounds, hypoactive or hyperactive. Next thing I'm going to do is listen for any of the any bruits in the vessels. So with the aorta, the renal, iliac, and then femoral. And those should not be present. That would be abnormal if those were present. Next thing I'm going to do is listen to over the liver and the spleen for any rubs. Which they would be abnormal if those were present, and they are not. Next thing I'm going to do is percussion. First I'll do the entire abdomen. For that it should be tympany throughout. It could be dull over the organs, or if the colon or the bladder's full. So do that in all 4 quadrants. Next thing for that, next thing we'll do is the liver, measuring the liver span. So we'll go to the the right mid-clavicular line, and percuss down over the lungs, starting with the lungs. It should be able to find where it's dull and make a mark. Coming from the abdomen, we'll do the same thing in that mid-clavicular line. And for this, it should be, the normal for this would be 6 to 12 centimeters, so I'll measure that. And that's about 7, so that would be a normal finding. Next thing I'm going to do is the percuss with the spleen at the mid-axillary region. That should be, there should be tympany, no dullness. It could be, if there's dullness, it'd be in a large spleen. I guess it's okay. Next thing I'm going to do is, let me have you sit up and then face this way. Check for, or the other way, I'm sorry. Check for the CVA for the kidneys. So, see if there's any tenderness. Right here. Any tenderness?
Nope.
Any tenderness?
Nope.
Okay. Lay back now. Okay, so the I'm going to actually palpate the abdomen now, checking for any masses or any abnormal findings in general. So the first thing you do is light palpation, which would be just about 1 centimeter. And then it would be deep palpation, which would be 5 to 8 centimeters. Up here, the colon, the liver would be there as well. On the left side, the stomach and the pancreas, also the colon. Down here, we would also have the colon that we'd be palpating. Important things, they're all important, but your appendix over here would be another one as well. The ureters, of course, are on both sides, and then in the woman, the fallopian tubes, the ovaries as well. So for the liver, palpating that, I'm going to put my hand down here. Let's do it this way. And the intercostal space, I would take a deep breath. Feeling for the border, it should be smooth. And then also I'm going to palpate the spleen. You're okay. Okay. Now we take a deep breath. On this side, I'll do the right kidneys as well. The left kidney. Good. So we take a deep breath again. Which would be abnormal to be able to palpate the left kidney. The right kidney. The right kidney could be palpable, but it's not abnormal if it's not. The aorta, to be able to find that, should be less than 2.5 centimeters. There should be a small pulsation there. I think, oh, that's it. So for the prostate exam, what we do for that with the rectal exam, you're not getting on this one. With the prostate, when you, it's on the anterior wall, it should feel rubbery and elastic. It shouldn't protrude more than 1 centimeter into the rectum. Normal size of it would be about 2.5 centimeters to 4. It should be non-tender. There shouldn't be any masses. You would palpate around the prostate to see if there's any masses or any tenderness, which there shouldn't be. And it just should be smooth and muscular. So I believe